My guest today is Karri Field, who is a physiotherapist who specialises in orofacial pain. She's doing her master's in that at the moment. She works at the Headache, Neck and Jaw Clinic in Brisbane, Australia. She's actually very she works a lot with singers and instrumentalists, as well as people who aren't, because these things are common to everybody. But I guess as singers and instrumentalists, we tend to feel every little thing that goes wrong. And I just want to start off this session in particular is a follow up from a conversation that we had a couple of weeks ago, and we were sort of a bit delayed in putting this together. But many singers and some instrumentalists wrote in and asked some questions. So because we couldn't go live, we ended up recording it and putting it on YouTube. And so the questions came in a bit later, and this is a Q&A session. So I want to start by asking you, why did you decide to specialize in orofacial pain, and what is that?
Yeah. So with the orofacial pain, it's pain anywhere that you can experience in the face or even internally inside the mouth. And that's where growing up, I had a lot of issues with my jaw. And so I was really quite fascinated as a teenager to go a lot more in depth into that region. But then also as I was becoming a practitioner, I was finding how common it was for people to actually have problems around their jaw, around their face. And the beauty of this area is how complex it is. So I might be treating somebody with pain in the mouth or in the face, but the problem could be coming from somewhere else.
Absolutely.
So the complexity and just how relevant it was to me in my own journey, and the ability to provide care. One day I'm looking after somebody with a whiplash injury. The next I'm working with this amazing opera singer. Another day I'm working with somebody with cancer. It's just really quite versatile.
It is.
Never bored. Just when I think I've seen it all, in comes another singer with another unique presentation.
Oh, exactly. Can I start asking you also just a general question? How common are these issues? What are the most common issues you see come up with singers?
So the most common I see is that despite the singing teachers going posture, 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 the client actually can't maintain a good posture. And that's when I go, right, what's stopping them from being able to perform their singing technique with a good postural basis? And that's actually one of the tips I wanted to give to a teacher. If
Mm,
you're seeing a student continually having that head creeping forwards while they're singing, and no matter how much you correct them to have that
mm,
neutral alignment of their head
mm,
over their chest, if they can't maintain that despite your corrections, you need to be able to go and see why. There are some people where they're physically not able to sing and maintain a good posture, and that's a main warning sign. The other
yeah.
more common one is just the TMJ dysfunction, when there's notable asymmetry in how the jaw's moving, that the jaw will
Mm,
be off to one side under any type of exertion, or it might be actually even on some very simple movements. For the general population, especially the growing children and teenager, that's okay. But for a singer, you don't want then all of that technique to now start to be strong with that uneven jaw
Would
position.
that be the same for a sax player or a trumpet player or a
Exactly.
trombone
So
player?
with anybody who is having then a high demand of using their muscles around their mouth and around their neck,
Mm-hmm.
if you're seeing then that they're uneven in the way they move their neck and their mouth,
Mm-hmm.
you want to make sure their technique is going to be on a nice strong, even platform. But there are some people, if I go to another extreme, somebody with scoliosis, where their increased curve of their spine prevents them from being even, they are still able to be strong and give some amazing performances, but they have to understand how they have to compensate for that unevenness.
Right. So you can actually get fit.
With
You
it.
can work with it.
Yeah.
Yeah, exactly. What would be the youngest age you have seen to that have developed vocal issues? What's the
I've
youngest
seen it
age?
as young as 3 years old.
Wow.
That was when a little girl fell out of a bed and absolutely hit her cheek with a big lump of a hematoma. So just swelling and soft tissue injury, and it hurt to talk. So she stopped talking. And when
Okay.
she went to talk, even when she went to smile, her face was lopsided. So,
Right.
but the brilliance is the young they bounce back.
Right. And what about singers, the youngest singers, for instance?
Younger singers, this is more during the teenage years.
Mm-hmm.
That's when it's quite common as the bones change shape, the muscles then lag behind. And you
Mm-hmm.
can then see some asymmetry, and that can be impacting on the effort of
Mm.
when they're singing. And so, yes, around the teenage years is when they might start to develop, say, a clicking jaw
Uh-huh.
or unevenness.
Mm-hmm.
And in the general population, you'd see that at about 20% of teenagers.
Mm.
And
What about some lifestyle issues? Can a lot of issues be caused by lifestyle habits, or is it all harmful? Is it vocal technique or is it both? Because, for instance, how important is our alignment in everyday life and
yeah,
habits, like how we sit on the couch, at the desk, look at our phones, all that kind of stuff.
the main one is the computer and the phone usage that has increased over the last decade. And
Mm-hmm.
so that's where it's not so much people are uneven and twisted, it's more that they're stuck hunched.
Yep.
And if that's something that they're perpetuating, then they're going to be applying increased tightness and restriction around the larynx.
Okay.
So it's not that you want to be a stiff, stuck robot, always in an
No.
ideal posture.
Yeah. Yeah.
You want to just be able to mix it up.
Yep.
So it's not about 100% being even. It's about being able to move through all different positions, not be stuck all day long.
Because you end up, the
Posture.
lordosis is that sort of slightly curved um, kind of thing in the
I
neck,
just
isn't it?
call it, yeah, it's a
What do you call?
increased chin poke. So that
Okay.
is poking forwards.
And how does that, does this
Okay.
all, does it straighten out the vertebrae as
So the
well?
vertebrae, they straighten out, or in the older population, you can actually see it develops a reverse curvature.
Right.
So it's then actually structurally adapted,
Mm.
being permanently in that reverse lordosis.
And that may cause nerve
It means
damage
that
or
the weight of
impingement.
the skull
Mm.
is resting very firmly on the joints, and you can get then pinching and irritation of
So
the nerve.
people talk about headaches and sore necks, etc., etc. That could
That's
be,
right.
it may be or may not be
That's it.
caused by
You can't
alignment.
say it is just alignment,
No.
because people, even with poor alignment,
Hmm.
they can use different strategies to make that a non-event.
Right.
But they have to be aware of their body, and they
Hmm.
have to be stronger
Mm.
in order to be able to perform.
Yeah. Well, I'm going to whip through some of these questions because we don't have you even for a whole
No, I'm
hour.
just with a short
No,
break
that's
today.
good. I just wanted to get through these, so because and I'll just mention the person's first name and where they're from. This is from Rebecca in Sydney. She's a professional singer and a teacher, and she said over the years she's had a clicking jaw, which is quite timely that we're talking about jaws and things, which has recently been treated. She said, touch wood, much
Yeah,
better now, but the stiffness and clicking may have been due to bruxism. Is that how you pronounce
yes,
it? Yeah.
yeah,
So, the grinding of the teeth. So, can you suggest any preventative exercises to help with that for my students who suffer with the same thing?
yeah. This is a main exercise that I teach to a lot of people. You can also use this as an assessment on your students if they need further support. If people are bruxing, which is the muscles around the jaw becoming very tight and overused during the night or during the day, then you need to see if you can relax the big muscles. And the way to do that is to get the tip of your tongue behind your top teeth on the roof of the mouth. And you should be able to keep your tongue still at the roof of your mouth while opening and closing your jaw. So it looks like this. Ready?
Okay.
Beautiful. Ingrid, you're demonstrating it wonderfully. But you also want to check while you're doing it that there's no pain, there's no clicking, and that you can keep your neutral posture with your head over your shoulders.
All right. So a nice lengthened spine.
Lengthened spine, the tongue behind the top teeth, like that for no position. And then you should be able to just keep your jaw nice and relaxed with a very small, gentle open and close. Okay. If they can't do that and the tongue keeps wanting to come off the roof of the mouth, they've got some serious tightness in those muscles.
Okay, that's a really great tip. Thank you so much. So it's more a warning sign for to maybe go and see somebody about that, because
should
it's
be a really easy way to relax the muscles. If it's not, you need further investigation.
What about just letting the jaw hang for a minute?
But this is where, for singers, it's not just the jaw muscles. It's actually the tongue and the way that elevates the larynx.
Got it.
And also the impact on the airways where your tongue's positioned. So yes, just letting your jaw hang is what the majority of people can get away with. But you need to be able to coordinate the tongue, the airflow, the head, and the jaw.
Brilliant, brilliant. Let's go on to the next one. What do you mean by opening the back space of the jaw?
Perfect. These questions all just line up.
They do. Well, I had a look at them. I tried to put them in some kind of order. But Sean is an amazing teacher and singer from Brisbane, and he also has a lot of young students as well. He wanted to know, what do you mean by the back space of the jaw? You talked about that a couple of weeks ago. He had a classical teacher who really got him open in that area. It was almost an open forward position, which kind of, of the jaw, which kind of concerned me that it might be positioned too, but he might be talking about something else. He said he may not be describing it well, but it would be great to see how you get to an optimal jaw position for clients and exercises around that.
Well, let's then go into a bit of anatomy, everybody. So the actual jaw joint is composed of two joints. So we've got the jawbone where it attaches to the skull, but it's separated by a disc of a cartilage disc. So where the jawbone interacts with that disc, that's one joint. Where that disc interacts with the skull is a second joint. And they move in different ways. So when I'm talking about the back of the jaw, I was being just very general, but I was specifically meaning the interaction of the jawbone and the disc. So the actual jawbone and the disc should be dropping down.
Yeah.
That's where it should be starting. And then the jawbone should be able to roll without sliding forwards.
Got it.
That sliding forwards action, I'm exaggerating it here, but that sliding forwards comes from the disc interacting with the skull. So when I'm talking about the back of the jaw, I meant the lower jaw with the disc rolling in the joint, not the sliding forwards action.
And when you watch MRIs of that, it's really quite scary when you see it off alignment. So would you call that position one when it goes straight down?
So position one, you're here and you should be able to roll and function without having to slide forwards.
Yeah, got it.
But that sliding forward should be when you're yawning, really wide bites,
Uh-huh.
It shouldn't be when you're trying to then be doing the majority of your talking. You'll have a little bit, but people, when they have problems, they just go straight forwards,
Got it. So that space you're talking about is
creating the
really,
space
really creating the space back here so that, yeah, it's nothing to
before
do
they
with the
roll
front. Yep,
forwards.
yep, yep.
That's what I
Got
mean
it.
by that.
That's brilliant. I'm glad I sent you some questions in
Yes, I
advance.
prepared for that one because
Oh,
it's quite involved.
that's brilliant, brilliant. Um, oh, some people are watching. I'm probably missing some of the extra questions, but we need to get through this
I don't
first.
have much time.
No,
We could always do another Q&A.
we can always do another Q&A. So if some of these things don't make sense, you need further explanation, or you want some, even if you've got some new ideas to throw into the pot, please put them down. This is live, so we can review it and come back to you later. So there is a question from a singer and who started teaching in Brisbane called Naomi. She said now she knows she has been grinding her teeth since as early as 14. She has severe TMJ disorder since she's had it as a teenager, as well as neck pain from whiplash, chronic headaches, and migraine as an adult. I mean, just the impact of that on singing alone. Anyway,
Yes.
but she's talking of I believe she's seeing, getting help for that. However, one of her students is only 11, and she sees that her mouth doesn't open symmetrically. She's concerned that she's starting to get TMJ dysfunction. Is she right to be concerned, and should she strongly advocate for her to see a jaw physio so she doesn't have her problems worsen as she ages, or is it a natural development that they grow out of?
I do suspect it is a natural development because of the age. As an 11-year-old, they're just starting to get the bigger puberty growth
Mm-hmm.
spurts,
Mm-hmm.
whereas quite often you'd have one part of the bone will grow
Mm-hmm.
and not necessarily the other part even match it.
Mm-hmm.
And it can simply be more that the muscles are not sure what to do with this changing shaped jawbone.
Yeah, yeah.
So go back to that tongue on the roof of the mouth and that jaw open and close,
Mm-hmm.
where you're trying to teach the jaw muscles how to relax and using that tongue to tell the jaw where the middle of the mouth is.
Mm-hmm.
And if after doing that exercise, the jaw's able to open wide and straight, you know it's simply the muscles needing to catch up.
Okay.
But you do want to check as that person grows and develops that it is just a transition.
Okay.
That's still persisting,
Mm.
or after doing that exercise, it's still noticeably uneven.
Mm.
It could be worth a further investigation, but
Mm.
only because of the training and the load that you're placing on that developing body.
Mm.
If that's a person who's not at a high level of performance and
Mm-hmm.
training,
Mm-hmm.
then they're not going to be as vulnerable to,
Mm.
to the asymmetry.
Because often the singer is can be the first port of call for a lot of other singers. Sorry, a teacher is the first port of call
Yeah.
for other singers, and that we have to really know who to refer them to if it's beyond our area of specialty, and that's a really important thing to understand, how to assess and then send them to the right people. So yeah, I'm really glad we're getting these questions. A second question from the same person is, you spoke of how you assess clients' tightness in their vocals, ribs and hips in the first session. What would we as singing teachers do for students who we see having tension and or pain in these areas? Should we show them gentle movements to help release those areas that we may be aware of? Or are we best to refer to specialists such as yourself as early as possible?
Oh no, the teachers are amazing. You certainly have a lot of insight with all of the amazing training that teachers have gone through.
Mm-hmm.
So please, if you're noticing this in your students, yes, show them different techniques that you as a singer have utilized to be able to help relax and release tension and to be able to mobilize. It's if those exercises are hurting or making it worse,
Right.
then look at some further
Right.
investigation and
Right.
support. But
Right.
no, please, I'd love it for the teachers to be able to continue to uh, support their clients without always having to go to a specialist,
Yeah. Yeah.
because it is a combined support crew
Yeah.
for the students and the singers. It's not just a physio or just a speech therapist.
Mm.
The majority of the singing teachers have already been through a lot through their own career and
Journeys.
training,
Exactly.
and
Exactly.
are continuing to be able to increase their own skills. So yeah, if
I mean, it could be as something as simple as hip flexors are really tight as well,
that's it,
and just giving them an exercise to stretch the hip flexor every
just
day. The
look
psoas muscle,
forward.
which connects, to the diaphragm and the ribs and the pelvic
That's
floor, is quite deep, and if it gets tight, it pulls you forward, and then of course you're going to get all this kind of thing. It's interesting how your area of specialty is pain here and the orofacial, but often it can be something like hip flexors or knees
right.
or, yeah. Moving on. Anyway, thank you for everybody who's asked questions so far. What's the relationship between the hip alignment and jaw? Just how much can one get away with it before it impacts on the voice? Say if your alignment's out in your hip,
Mm.
um, how many centimeters can be out of alignment before it becomes a glaring issue, or are there other factors?
I tend to say it's not a matter of the degree of malalignment,
Mm-hmm.
how far uneven it is.
Mm-hmm.
It's more how strong you are in the muscles that are going to reduce the impact of any malalignment in the spine below, and how strong you are at here up.
Oh.
Because, like I said, somebody with scoliosis, where their hips are perpetually in a twisted position,
Mm-hmm. Mm-hmm.
can still be able to achieve this beautiful vocal and posture, but they've had to compensate and had to strengthen and understand how to manage their body.
Mm.
It means, though, that muscles are working harder, not as efficiently,
Mm.
and there can be more pressure.
Mm.
So, in an ideal world, you're able to have everything perfectly symmetrical around the pelvis and
Mm.
through the spine up to the interactions with the jaw and the head. But only about 2% of the population are symmetrical. The rest of us are having to work pretty hard at keeping ourselves together.
Yep.
Nonetheless, I usually, as a rough indication, if I see that the hips are uneven by about a finger width, I usually see that's a very inefficient pattern. And that's where they can be uneven, where one hip can be higher than the
Mm.
other,
Mm-hmm.
or it can be uneven where one hip is further forwards.
Yep.
So if I'm resting then my fingers on the hips and one's higher by a finger width or one's further forward by a finger width,
Mm-hmm. Mm-hmm.
then that's when I'd be going, all right, if you then correct your posture, does that correct? If it's still uneven, yeah, it might be worth getting a massage or doing some additional relaxation of muscles and stretching. But if it's still uneven after you've looked at protecting your body,
Mm.
then yeah, you need to see why is it not able to return to neutral and
Mm.
understand your body, so
Mm.
you can then be able to compensate and manage it without pain.
It sounds like you really have to evaluate everything you do in your life, look at your
Mm.
history of injuries, etc., which could have created something. It could even be dog walking a puppy. Ha,
Yeah.
we don't want to talk about that, but and it takes off, and then that sort of gets you out of. It depends, on whether you have a very flexible um, body as well. When I say flexible,
Yeah.
you know,
Some people are very stiff in the joints, others are
yeah,
very loose in the
some are
joints.
too hypermobile. I was going to say if you're
Yeah.
hypermobile. Um, there's a subject that's come up from Tina from the USA. She's a singer and teacher. She talks about overuse of our voices. Can you suggest easy exercises to help relax muscles like humming, etc.? And also because muscles do get larger, she said. How about sharing ideas for keeping them more flexible and loose? Does breathing and steam help? Do you have any tips for everyday maintenance?
Nice. This is where, for singers, it's not just about strength, it's about having the extra flexibility to clearly form the shapes within the mouth with the different vowels and the tongue, but
Mm,
also then the different airflow pressure, and then also the actual elevation and depression of the larynx in order to go through the different registers. So
hmm
this is where a really easy way to see if you've got enough length is if you can actually get your tongue and roll it around your front of your teeth in
hmm
both directions.
hmm
And you should be able to easily do that 10 circles in each direction without it hurting or fatiguing.
With your
And
mouth
for,
open or closed?
it doesn't matter because you're just trying to get some
Mm-hmm.
general movement. It's not
Mm-hmm.
a specific technique.
Mm-hmm.
And I find with that one, if you're fatiguing after just a few circles, then that's a sign that, yeah, you're actually overusing the tongue, and that can lead to more the tongue root tension.
Got it.
And doing the circles is a way to actually maintain flexibility of the muscles from the tongue and underneath the tongue to the
Mm.
floor of the mouth down through the
Mm.
larynx.
Nice.
So that's a main one that I give to a lot of people who are using their voice a lot
That's
as
all
a
without sound. That's all without
that's
sound.
without sound.
Mm.
The ones then for more efficiency of the actual vocal cords,
Mm-hmm.
that's really about trying to hum and then hum through an actual scale to check, can you maintain that efficient closure of the vocal cords, but while going through to the higher register and the lower register, which is then going to be involving the movement of the larynx and different flexibility of the muscles as it elevates and descends.
Mm.
The last one is an actual singing warm up, which is perfect for maintaining flexibility.
Mm-hmm.
And that's where you've got the lip trills of blowing a raspberry, of vibrating the lips while then elevating and descending through a scale. But you can also add that with your tongue between your lips and trying to then blow the raspberry
Well,
while singing.
that's my favorite. I was just
There
about
you
to
go.
say
There
my
you go.
raspberry is a real telltale. If you've got
Yes.
tongue retention, that's fantastic to do a raspberry. And
So if you can do the raspberry and an ascending, descending scale,
hmm
you have got awesome length and flexibility of the
great.
muscles from the tongue and around
Yay.
the larynx.
Yeah.
Yay!
Yay. And I mean, with proper social distancing, because there is a
Yeah,
lot of um,
that's right. Yes, please don't do that
projection.
in front of somebody's face.
No, no, not good. That's terrific. So yeah, so we've got the tongue
Tongues,
aiding
circles.
around um, clockwise and anti-clockwise 10 times each way, and then raspberries are
But
good.
the raspberries is the going for gold, showing off at how good you are. And you might want to start, if there's
Yeah.
pain, you might want to start just with a humming,
Mm-hmm.
going through a scale with a hum
Mm-hmm.
or a
Mm-hmm.
siren, which is
Mm-hmm.
sometimes a bit more familiar to the singers.
Mm.
And then the next progression is to do that while vibrating the lips or a lip trill.
Mm.
And then you can show off with the raspberry instead.
Because in my experience, it's not. Sometimes it's actually a breath management problem. You
Yes.
know, if we're using the wrong muscles to um, to breathe out or to when we're singing, so we can get really tight and our ribs collapse, and
Yeah,
that can stop the airflow, which then stops the tongue or the lips from vibrating. So there can be a deeper issue
exactly.
of breath management there as opposed to articulation or
Yeah.
etc etc. Just quickly going on, another singer called Kate says, could I ask Karrie if Karrie has any thoughts on MTD, muscle tension dysphonia, and how to manage the pain, any stretches or self massage, or Is this even something a physio can help with, or is it more suited to a speech pathologist?
I see a lot of clients with this muscle tension dysphonia,
Mm-hmm.
and that's where the first port of call has to be the speech therapy and the ENT, ear, nose, and throat specialist.
Mm-hmm.
But if they're seeing that there is a lot of restriction and tightness in the muscles, then that's where the physiotherapy assessment can come in.
Okay.
Yes, it may be a matter of doing stretches, but I actually see quite often in the singers, it's more a matter that the muscles are just overworked.
Yep.
And so, one strategy I do as an assessment is have somebody sitting in front of me, I'm
Mm-hmm.
standing behind them, and then all I do is I get my hands and I cup it underneath the base of the skull.
Mm.
And then I get them to, without my hands, they do a singing warm up or a
Mm-hmm.
phrase that they
Mm-hmm.
know they struggle with.
Mm-hmm.
Then I place my hands underneath the skull and I just hold the weight of their head for them.
Mm.
And if their pain eases and they're able to sing that phrase easier, you know, it's not just a matter of stretching,
Mm.
it's a matter of they're too weak in the muscles in the neck to hold their head up. And
Yes.
instead, they're overusing their vocals
Mm.
so that the muscles that elevate and depress the larynx are actually overworking to hold the weight of their head as well.
That's interesting. I like the idea of the this.
That's an
I
assessment tool singing
Yeah,
teachers can utilize.
I've done this where I've put my
So,
hands like
yeah,
this with one
yeah,
hand and just to
just to
and I've asked
correct
them
the
to put their
posture.
finger, yeah, just to sort of help them with the lift. And they do feel the difference, and usually it's very clear going up and down, but then it doesn't last. So as you
Exactly.
say, it's because they're fatigued or because they don't have the strength or because they're too forward,
So
etc.
that's where, with the actual muscle tension dysphonia, some
Mm.
stretches, it is a
Hmm.
matter of just lightly stroking the front like you're stroking a cat.
Oh, okay.
And that's sometimes easier when you've got some moisturizer cream. So you can
Yep.
just really glide. You don't want to
Yep.
go digging in hard into this area
Too
because
many
it has
arteries.
some very important blood vessels to your brain.
Right.
But that light, gentle massage is a starting point.
Mm.
If it's needing more than that, I'm afraid it needs an actual assessment. It's not a one rule fits them all. It is quite an individual procedure to get some good stretching
Mm.
and flexibility. But you can start with that tongue on the roof of the mouth, jaw dropping. You
Mm-hmm.
can then move on to the tongue circles.
Mm-hmm.
You can progress to just getting your general sirens, the humming, the lip trills, and the actual raspberries. But in most of the singers with muscle tension dysphonia,
Mm-hmm.
they're actually overusing the muscles around the larynx because of weakness in the postural muscles at the base of the skull. And
Right.
that's needing more strength
Yeah.
and a more specialized exercise program.
Yeah, that's interesting because this singer, does breathe well. Like she does
Yeah,
use her
yeah.
lower abdominals to support the breath, but obviously that it must be something else. So that could that just be a lifestyle management thing, or is it why would it be weak? Because
Usually I see it's after a series of illnesses
right.
or fatigue.
Mm-hmm.
And that's where, in the more dramatic instances, it's after a
Right.
whiplash.
Mm-hmm.
But when people have been performing for a long time, they tend to push themselves
Yeah.
where their body, when they're performing when tired,
Mm-hmm.
they just use whatever they can to get the job done.
Mm-hmm.
And that's when it starts to then be overused
Mm.
and it progressively tightens and doesn't automatically reutilize the correct muscle patterns.
Mm.
So quite often I actually see it when people are performing after they've been ill or
Mm.
while they're ill. That's very common
And I
in
mean, if
the
you're a school
lifestyle.
teacher, you're a vocal performer.
Exactly.
So, this you still have to plow through. You have to turn up and
Yeah.
you're using your voice. So, no, that's really good. That's a
I've got
great
time for
answer.
one more question.
Time for one more question. Okay, you choose. The choir smile, hard to teach long-time choir member
Yeah.
to smile from the inside other than a dreaded letterbox smile. Any suggestions? Or flat feet, is there any relationship between flat feet and your jaw? That's from Sue from the Sunshine
Yeah.
Coast.
Okay, very quickly with the flat feet. I am going to answer both. I can't resist. The flat feet is more that you don't have good shock absorbency or good support for the weight of your body. And so that's then going to be increasing your general body tension. So yeah, that's
Right.
where it's more the general tension that builds and progresses from the feet up through the entire body.
Mm-hmm.
But then going more from the awareness of the different types of smiles and the different uses of muscles. A lot of the muscles innovated with the sort of letterbox gripping are easier for you to find and use because they're more similar to what you'd use in day-to-day actions. Whereas the muscles you're using to be able to sing and do the inside of the mouth, people don't even know they have those muscles.
Yeah,
They
yeah.
don't think about all of the inside of the mouth.
Mm,
But that's where it might be a matter of actually building up awareness of what those muscles are like. What is the shape of the inside of the mouth?
mm-hmm.
And that's where I get people to be able to use warm water inside their mouth and move the water around inside their mouth, inside their cheeks, the back of the mouth, the front of the mouth. Just build up their awareness that they've got muscles in that area.
Mm,
The other one I tend to see is that letterbox smile. Might be because everything's just gripping from sheer terror and adrenaline
mm,
while they're performing. And
mm,
they might need some really good relaxation or how to be able to get the muscles that get that lovely letterbox to release.
mm.
And one tip you can do there, I'm going to demonstrate, is puffy cheeks.
Oh, it's my favorite. Yeah.
And that just helps all of those really deep muscles just let go and
Mm,
expand
mm,
and be able to see if they relax the muscles that are easier for them to find with that letterbox action.
mm.
Can they then let that go, find a different group of muscles inside their mouth
Yep.
and get that sensitivity and performance
And you
capacity?
can do the puffy cheek with, on 3 octaves on scales and intervals and patterns and all sorts of things like that. So all those exercises you can do.
You can really play and make this work for your teaching style and the students' needs.
You're combining some physiology, some technique, vocal technique, sustainability, and developing, agility and flexibility and all that kind of thing, as well as learning scales. You can do it both at the same time. Look, that there were a couple more questions, but honestly, you have given us a mental overload. And there were, just noticed someone saying, what, can you demonstrate a raspberry? Well, maybe I should
Or
have a little, oh, I don't
I
know.
can't do it off the
I
without
can,
warming up. That's
mm,
actually something that if I can get that, that means I've had a really light vocal load today. And
right.
after talking for more than half an hour,
Not even
I,
sure if I can, but
I actually need to be out of
that's it.
ease.
That's it, Stu. It's a wonderful look, isn't it?
Oh, very
My
great.
daughters say you don't do that to you with your students, do you? Yes, no holes
We
barred.
do pull a lot of funny faces
We
in the
do.
appointments.
We do. So, look, I just want to thank you again, Karri Field from the Headache, Neck and Jaw Clinic. I hope you've enjoyed this session on Q&As. If you've got any more questions, she's she's really nice. We might be able to even twist her arm again to
We'll
answer
see
some
how
more.
we go.
We'll
See
see
how
how
we
it goes.
go.
She's a very busy person, and everybody keep well and yeah, just stay well and happy.
Thanks,
Okay,
Ingrid.
see you later.
Bye.
Bye.